prepare for the Omicron variant to turn up in New York City, we may be on the brink of another mask mandate.
And we do anticipate detecting Omicron in New York in the coming days based on what we know about its global spread. Strongly recommending that all New Yorkers wear a mask at all times when indoors and in a public setting, like at your grocery or in building lobbies, offices, and retail stores. This includes those that are vaccinated and those who've had COVID-19.
The New York City Health Commissioner issuing an advisory for mask usage as coordinated efforts get underway on the federal, state, and local levels to prevent a spike in COVID cases, but stopping short of a mandate. Public Advocate Jumaane Williams says the city needs to take stronger steps to protect the public, and Public Advocate is joining us now to explain what else needs to be done. Mr. Williams, good to see you. Welcome back.
Thanks for having me, Dan. Always a pleasure.
So let me get right into it, because there's a lot we don't know about the Omicron variant, right? But you say mandates should go into effect. What kind of mandates are you actually talking about, and for whom?
Well, right now, we have to be clear. I do agree with the message that we can't panic, but we do have to remain diligent and learn the lessons that we should have learned from the last time we were at this point. And so one of those is the mask advisory, which we have to actually make statewide. And that's one of the problems. It's not statewide yet. And we have to push that with a clear message to really encourage people to do this. And we are getting really close to the point where we may have to push even harder. We have to change what we're considering the vaccine mandate now. Right now, if you have one vaccination, that counts. It really has to go to 2, and we have to start making sure that people are enforcing that. And lastly, just across the state, we do have to make rapid testing at home available, and we can use a lot of the federal money to do that, because outside of the city, it's often very difficult or expensive to get those kind of tests.
Yeah, the mayor and the health commissioner also said COVID testing is key to staying safe. So do you think that testing mandates should also go into effect?
You know, inside of the city, we've been having a pretty good way of getting those tests, and some of them are accessible. We should definitely increase that to make sure that we're doing it at the level that we need to at this moment in time. Outside the city, not so much. County execs don't have the same kind of funding or infrastructure to do that. And so we really need the governor to step up in those cases, because as you know, the virus doesn't stop when it hits the city line.
Yeah.
And so we need to make sure there's a clarity of and coordination in the effort.
Yeah, I want to a little clarity on what you said a moment ago. You said a mask advisory, not only in the city, but statewide. So you're saying an advisory, not necessarily a mandate for mask wearing.
Yeah, only because I think we have to give New Yorkers an opportunity, a short window of opportunity to actually get it right. We know that the mandate stirs a bunch of issues that if we can avoid them, we should. But we should be very, very strongly wording that this advisory needs to go into place. And so this is not an optional thing in terms of whether it is the right thing to do or not, and we have to change signages on doors. There should be public service announcements and signs saying that this is what New Yorkers need to do. But we have to assess very quickly if it's working.
Yeah, and wearing masks can be really critical, especially when there remains pockets of communities like on Staten Island and in the Bronx where residents remain unvaccinated. So what steps do you think the city needs to take to get everyone on board with that?
You know, this is the area that has been a bit frustrating, both in the city and the state level. Thankfully, we have done a decent job in increasing the amount of people who are vaccinated, but there are pockets and there are communities of hesitancy. And we've been pushing for a very long time. There's an infrastructure that was in place to get the census in some of these underrepresented and underreported communities. And we've been pushing for a long time to just re-up that infrastructure, get some money to that infrastructure, attach that infrastructure with nurses, because what we found is when people agree, you got to get a nurse right there or someone to give them the injection, or else they're going to change their mind. Connect those two things in a way that hasn't happened. And I think we might see some increases, not just in the state, the city, but also the state. I haven't really understood why that hasn't happened yet. So
given the new variant, which may impact people who've already been infected, you know, the governor has already talked about canceling elective surgeries, so on and so forth. A lot of people look to elected leaders to see what exactly they would do and what their thoughts are to keep everybody safe. Where do you stand as we head into the holiday season on things like a celebration in Times Square, which is back on? Do you think these things need to be looked at once again, be canceled or adjusted?
We absolutely have to look at these things. One of the things that we did not do was act quickly enough when the virus just started. We can't make that mistake again. I can't say right now, based on what we've seen, that these are things that we should say are going to be canceled, but we have to monitor very heavily. I think we have to lower the types of traveling that we're doing. We have to be clear on the messaging on masks.
What do you mean by lower the travel?
I think people should be reconsidering whether or not they're going to be traveling right at this moment in time. But if folks are, particularly if they're doing stuff within the continental United States, we want to make sure that people are masked up and people are vaccinated. Those are very, very important.
Yeah, here's one of the big concerns. Nobody knows at this point where Omicron came from, where this variant originated from. So we don't know if it came from South Africa, if it came from, we're now hearing that Dutch authorities are saying that they had cases in the Netherlands 11 days before South Africa. So we don't know where it's coming from. And now we're seeing a steady increase in the number of tourists that are arriving in the city, especially after the international travel ban was lifted just 3 weeks ago. So do you think that the ban should be reinstated now?
So this is the concern, right? And my guess is in the near future, we're going to see these different kind of variants. And so we have to have steps that are clear that we're going to take to keep people's peace of mind there. And so we have to say when these variants come up, we have to heighten it a little bit. We don't have to go as far as we did, not too long ago, but we have to heighten it and take steady, clear steps. Right now, that is making sure there is a statewide mask advisory, making sure that folks have access to rapid testing, and that we make sure people are vaccinated. And then we have to elevate those steps very quickly, depending on the information that we get back.
Understood. Public Advocate Jumaane Williams, I'm going to ask you to take your public advocate hat off for 1 second, because I do want to ask you, as a gubernatorial candidate, just your thoughts right now. We have a new contender entering the race, Tom Suozzi, who announced yesterday that he plans to run against you for the Democratic nomination. Your thoughts?
I've spoken to Tom a number of times. There are a lot of different folks who are vying to be elected governor. That includes the current governor. None of us have been elected, and I think all of us are going to present our vision for what this state should be. And so I welcome folks who want to do that. Tom's been a public servant for quite some time, and he obviously has a vision that he wants to put forth. I have a vision that I'm putting forth. I think that vision is the right one at this moment in time, especially as voters are repeatedly saying that they don't want to return to normal. They don't want elected officials of yore that just really focused on incumbency protection and status quo. That's really what helped get us here. And we're saying that we need more than that. We can't return to normal to get where we need to go, and that our campaign really represents that.
Understood. Public Advocate Jumaane Williams, appreciate you being here this morning to talk about a really important issue for so many.
Thank you. Peace and blessings.